What happened? That the whole of the heart is relaxed. Okay, the atrioventricular valves are open because the atrial pressure is still slightly greater than the ventricular pressure. Okay, so as we seen that uh, the atrioventricular valves are open because the atrial pressure is slightly greater than the ventricular pressure, because in the heart the atrial pressure is greater than the ventricular pressure. Okay, so the atrioventricular valves are open. The semilunar valves are closed as the pressure in the pulmonary artery and the aorta is greater than the ventricular pressure. Okay, the semilunar valve. Okay, the semilunar valves are from the ventricles to from right ventricle to pulmonary to the lungs through the pulmonary arteries, and from the left ventricle through the aorta to the whole body. Okay, the semilunar valves are closed. Okay, as the pressure these valves are closed as the pressure in the pulmonary artery and the aorta is greater in the pulmonary artery and the aorta are greater than the ventricular pressure. Okay, so basically the pressure in the ventricles are at the lower side, and the atria and the main arteries their pressure are on the higher side. So the atrioventricular valves are open and the semilunar valves are closed. Okay, so what happened then? The cycle starts when the sinoatrial node initiates the atrial systole. Okay, so cycle when starts when the SA node initiates atrial systole. The SA node where it presents, so it presents here between in the septum between two atria. Okay, the cycle starts when the SA node initiates the atrial systole. Sorry, the SA node is somewhere here and the AV node is here. Okay, so the cycle starts when the SA node initiates the atrial systole. SA node initiates the atrial systole. Okay, now diastole, atrial systole, AV valves open and semilunar valves are closed. Okay, so what happened in the atrial systole? Atrial depolarization causes the P wave on the ECG and initiates atrial contraction. Atrial depolarization causes P wave on the ECG. On the ECG, there is P wave which occur during the atrial systole and initiates atrial contraction, and it initiates atrial contraction. Okay, then atrial repolarization is too diffuse to be seen on the ECG. Atrial repolarization is we can't see on the ECG. Okay, now because it is too diffused, as the atria contract, as the atria contract, the atrial pressure increases, which force more blood flow across the open AV valve. The atrial pressure increases, which force more blood to flow across the open atrioventricular valve. The blood will flow from atria to ventricle, from the atrioventricular valve, leading to rapid flow to blood into the ventricle. The rapid flow of blood will occur into the ventricle. Okay, there are no valves between the vein and atria, and atrial systole causes a small pressure rise in the great veins. Okay, there is no valve between the atria and the veins. Okay, the inferior vena cava and the superior vena cava, there is no valve in between the atria and these veins. Okay, so what happened? So it causes veins and atria, and the atrial systole causes small pressure rise in the great veins, and the pressure rise will occur due to this systole into the great veins, and the A wave on the JVP waveform, and we will see on the JVP waveform there is small A wave. Okay, at this time of the P wave on the ECG. Then what happened? At rest, atrial contraction only contributes the last 15 to 20% of the final ventricular volume. At rest, atrial contraction only contributes at least 15 to 20% of the final ventricular volume. 15 to 20% of the final ventricular volume. It only contributes 15 to 20% for the final ventricular volume. So other volume arise from which, that we will see later. Then, as most of the ventricular filling has occurred passively in the diastole due to venous pressure. Okay, most of the pressure occur during the diastole due to venous pressure. The proportion of atrial contribution increases with heart rate as diastole shortens and there is less time for passive ventricular filling. The proportion of the atrial contribution increases with heart rate as diastole shortens and there is less time for passive ventricular filling. Okay, due to when the heart rate rise, the pressure in the ventricles will increase, will more due to atrial contraction than the venous return. Okay, because at that time the time for diastole of the ventricles will decrease. So whichever blood comes, it will comes due to ventricular systole. Okay, understood? Okay. The end diastolic volume is usually about 120 to 140 ml. Okay, the end diastolic volume is usually around 120 to 140 ml, and the end diastolic pressure is less than 10 mmHg, and the end diastolic, this is the end diastolic volume, and the end diastolic pressure is around 10 mmHg. Okay, and higher in the left ventricle than the right. It is higher in the pressure will be higher in the left ventricle than the right ventricle. Why? Because thicker and therefore stiffer left ventricle. The left ventricle is thick and due to that it is more stiff. Okay, in ventricular hypertrophy, filling of the stiff ventricle by atrial systole causes a fourth heart sound. When there is ventricular hypertrophy, okay, filling of the stiff ventricle by the atrial systole causes a fourth heart sound. Okay, fourth heart sound, which is not audible in normal adults. It is not normally audible in adults. It is only seen in the ventricular hypertrophy. Okay, so this is the atrial systole, which is seen in the cardiac cycle.